my name is Thomas Breyer. I'm the Director of Fire and EMS Operations with the International Association of Firefighters. And we're going to be talking about community approaches to the opioid crisis. And I'm joined by President Rob Weeks and Brother Brian Nee. I'm going to give them a little opportunity to introduce themselves. Rob, why don't we start with you?
Yeah, sure. Thank you. My name is Robert Weeks. I'm the president of Vancouver Firefighters Local 18. I'm also the executive vice president of our provincial association and the district field service rep for the 6th District IFF.
Thank you, Rob. Brian, would you like to introduce yourself a little bit?
Yes, thanks, Thomas. My name's Brian Nee. I'm a lieutenant with Boston Fire. I've been a firefighter for 15 years, and I've worked for the City of Boston Fire Department for 20 years. I started my career in their EAP office as a licensed alcohol and drug counselor.
Fantastic. Thank you very much, both of you, for being here and participating in this discussion. As we all know, the opioid epidemic has deeply affected our members and the communities that we serve, but the demand itself has affected our ability to respond to other emergencies, as well as generated some caregiver stress. Rob, let's start with you. What was happening in Vancouver ahead of the changes the department initiated to address the increased demand that resulted from the opioid epidemic?
Well, I think first I'll give you some perspective on who we are as a department. So we've been a fire service since 1886. We've been a local of IFF since 1918, and we're in fact a charter local of the IFF. We have 800 members and represent the city of Vancouver with a population of 700,000. We noticed a significant change in 2016. That's when we started to notice something was different. We've always had an area called the downtown east side in Vancouver. It's a small area, about 6 square blocks. It has 18,000 residents though, and at least 50% of them are drug users. And that area is serviced by 2 fire trucks in what we call Station 2 in the downtown east side. In 2016, we started noticing a significant call bump. Prior to that call bump, that fire hall would have seen a call volume of about 600 to 700 calls a month. And once that change started happening, that increased dramatically, doubled actually, to 1,400 calls a month with no increase in staffing. So that was where we really noticed things were changing, and they were changing dramatically. Also in 2016, the government in April announced a public health emergency. So that's sort of the background of what happened.
Thank you very much for that. Brian, how about you?
A little background on the City of Boston and the fire department. The City of Boston right now probably has about 725,000 people living in the city, but during the week, Monday to Friday, there could be 2 million people. Our fire department is made up of right around 1,400 members. Our fire department is different from EMS, so we respond as first responders. Most of the firefighters are EMTs, but for years we were not carrying Narcan, and the union Local 718 was trying, but the prior administration would not go for it. So in 2013, we got a new mayor who was labor friendly, and by 2014 we were carrying Narcan on every apparatus. And since that, I think we've saved over 3,500 lives from just the Boston Fire Department administering.
Great, thanks, Brian. So what kind of program did Boston initiate to address this public health crisis beyond just adding Narcan to the apparatus?
Like I said, we had high numbers of BFD administering Narcan, and we noticed that we were going to the same homes over and over. Myself, when I was working in East Boston section of Boston, as a lieutenant, we responded to the same home 3 times in 1 week for an overdose, and the family just didn't know what to do and what resources were out there. So in 2016, we started this program called Knock and Talk, where we partnered up with Boston Public Health Commission and EMS, and we go to homes after there's an overdose. There'll be 2 firefighters. Our EAP, all our EAP members are in recovery. And then we have a few other firefighters from Boston who help out with this program who are also in recovery. And a lot of these firefighters have certificates, whether it's a recovery coach or being a licensed alcohol and drug counselor. And we partnered up with Boston Public Health Commission, and we'll go to the home, and offer service and to them and also to the family.
That's outstanding, and thank you very much. Rob, what did Vancouver's fire department do to address this spike in demand you were discussing earlier?
Well, first I want to just add another piece too, because I think it's important information. And Brian, we're similar to the service in Boston, that we're a first responder service. So we have a public ambulance service, but that's administered by the province. On the municipal level, we're first response. So we don't transport, but we certainly arrive on scene to any critical medical call, and an overdose would constitute that. So that's just some further background. If I will, I'll talk about the first thing that we did that happened in 2016, 2017, and then later I'm sure we can talk about how we've continued our strategy moving forward and what the outcomes were there. But as we saw that call volume spike that I talked about, going from 700 to 1,400 runs a month, we really saw a need to frame this issue for the public. And it wasn't a hard issue to frame, given that there was a public health emergency declared, and quite frankly, people were dying in the streets. So what we ended up doing is what we thought was a simple bit of advertising, and primarily it started on social media. And you know that old expression, a picture says 1,000 words. We just started putting a picture of a calendar up with the increase in call volume month to month to month, with some commentary about, you know, what our first responders were experiencing and what the people of the downtown east side were experiencing. That gained incredible amount of traction, and not just on social media, but you know, we got regular media on board, which led to a considerable amount of interviews, both on television and in radio and newspaper. And eventually what that manifested itself in is city council being keenly aware, and the mayor actually putting out on Twitter that we hear you and we're going to address this. How they addressed it is they voted on a 0.5% property tax increase, specific for our needs as the fire service in the downtown east side. And that allowed us to get an extra truck out of that fire hall. So that fire hall was only serviced by 2 trucks that were responding to 1,400 calls a month, and was augmented by an additional truck through that work we had done through the media and through branding our service and ensuring that the public was aware of what was going on in the downtown east side for our members and for the public.
Great, thank you very much. And I really appreciate hearing how you were able to leverage your data to increase your funding capabilities. That's great. And actually is an excellent segue in your outline of the steps that you guys took to implement your plan is an excellent segue into asking Brian, what steps did your department and the city take to be able to put the program into service?
Partnership was a key component, partnering up with EMS and Boston Public Health Commission. And like I said, we had a labor-friendly mayor, and we had a commissioner who were wanted to help these people who were suffering. Like I said, most of these overdose deaths were happening at homes. On the street, a lot of people already had Narcan, so if someone overdosed on the street, someone else would administer Narcan and they'd be okay. But the deaths kept going up, like Rob said, from 2016. That's when it got really bad, and we started our program about 6 months after that. And how the program works is, so if we go on a call tonight and we administer Narcan at a home, we'll code it a 321N. The next day, the people from the EAP, Lieutenant Pat Hayes, who runs the EAP, they'll go through all the 321Ns from the night before, and then they'll get the team together. There'll be 2 firefighters, like I said, and a lady from Boston Public Health Commission. We'll go to the home, we'll knock on the door, and hopefully they'll be home and want to engage with us. A lot of times, the person who overdosed might already have got help or might still be in the hospital, but the family will show the family how to use Narcan and leave a few Narcan kits with them in case it does happen in their home again. And we'll also have some resources for them if they need some help themselves. There's programs called Learn to Cope in Massachusetts, where parents of struggling addicted kids, the parents can go and talk to other parents and get some resources, and sometimes just to talk to someone. We try to go 3 to 4 times a week out. Sometimes we can go more, sometimes less, but when you're doing this, the sooner you get to the house, the better off you are, because once someone overdoses once, they have a better chance of overdosing quicker the next time. So we try to get there within 24 to 48 hours.
Fantastic effort from both of you guys, and again, just that hearing that the fire department is just the best place to go for prevention in your communities. What kind of results did you guys start seeing, and how were you collecting data and tracking the outcome of these programs and the change in deployment model? Brian, why don't you lead us off this time?
The success has been great, especially now after 3.5 years. We are seeing the overdose deaths going down in Boston. That can be contributed to our program, but also in Massachusetts and Boston, we've done a great job training people in Narcan, and Narcan's everywhere. So the numbers have gone down over the last few months with COVID. They have gone up somewhat, and we'll address that after this is all over. But just some statistics from 2019, we went to 500 homes after someone overdosed there. 84% of the time, people were willing to engage with us. 92% of them, when someone answered the door, were trained in Narcan. So now they have Narcan at their home in case this happens again. And I know opiate addiction is out there in the forefront and everyone knows about it now, but there are still people who have that stigma and they don't want to let their neighbors. Boston's very closely populated and people don't want their neighbors to know what's going on in their homes. So just they don't know where to turn. And when the fire department shows up and say, hey, we're here to help, they're amazed. We went to bilingual. We have literature in 7 different bilingual languages, and we have a female on the team who speaks Spanish, and that's been tremendous, being able to communicate with these people. And just recently, we trained, we got a SAMHSA grant for 4 years, and that we were able to hire someone to run this program. That's his main job, this guy, Eamon Miller. Through that, we also put 12 more firefighters to the recovery coach training, so they will be able to go out on the street and help us even more. And they'll also be able to bring that back to their firehouse, because I even know myself, when you go to 5, 6, 10 overdoses a day, you can get that compassion fatigue. So just having someone who has a little more training and be able to talk to the members and say, just remind them like, hey, this is that job. If you need help yourself, get some help through your peer program. Just having a little more empathy from going to the recovery coach training, and we plan on training more firefighters through that.
All right, great. Thank you very much. Rob, what about you guys? What kind of results did you start seeing after you initiated your response changes, and how did you guys start collecting data and tracking?
Yeah, that's a great question, and it segues into what we did next. So, we really did an effective job getting that additional fire truck to augment that station from 2 to 3 with really being engaged publicly. And we really followed the IFF model to make sure that we had, really strong branding in the community prior to needing the community to support us. So that really helped. And we've always been politically engaged. We followed that, the IFF model. So on those 2 fronts, being engaged with our branding and out in the public for a long time, and being politically engaged for a long time, we were able to get that additional truck. But what we did notice is that we weren't strong on data, and we needed to be much stronger. We really need to own our data in the fire service. And although we did use data to help support getting growth, it was nothing more than call volume and overdose deaths. So we saw a need, and we created a data analytics committee in 2017. And that committee is up and running and doing great work for us now. We engaged the IFF to provide a GIS for us. The IFF provided that in 2017 and then followed that up with an update in 2019. And it really showed some striking things. For example, in our downtown core, which is our highest density area, where that downtown east side part of our community resides, we were short coverage for an effective response force by 40%. We were 40% of the high rises in that area. We weren't able to mount an ERF. And that's significant. And that's considering that all of our trucks are in the barn. And given the call volume I talked about on the downtown east side, that's not the case most of the time. So how do we capture that? So with using IFF tools, using business intelligence tools in this data analytics committee, we were able to effectively show that our response capabilities were significantly diminished in the downtown core, not only because we were busy and our trucks were on the road, but also because of that high call volume in the center of that downtown east side, other trucks from other jurisdictions were getting pulled in a significant amount of time, up to 20% of the time for 20% of their calls. So that not only does that affect our downtown core, we realize it has profound effects outside our downtown core. And with that data, we were able to inform decision makers about what was happening in the fire service and our need to address this, particularly when it comes to staffing and staffing growth. Our department and our chief has been incredibly cooperative and allowed us access to all the data they see. They engaged on a consultant report and partnered with us because we really became, experts in this field, and they used us as partners as they endeavored down their own consultant study. And we were really able, with the tools provided by the IFF through GIS, to effectively show the dramatic increase in risk our city was seeing due to the opioid crisis. And I'm really happy to say that out of that consultant report and out of our good advocacy, we're now we're on a 5-year growth plan that was passed by council. That 5-year growth plan is going to add another 122 firefighters to our city, much needed firefighters. And in addition, we're adding another truck to that downtown east side. So we started with 2 fire trucks there in 2016, got an additional truck in 2017, and we're about to go live next month with a 4th truck. All that is because we're really starting to own our data. And I can't stress that enough for all locals out there, that we really need to become experts on our data and use that data to inform decision makers.
Fantastic. Thank you very much. Those results are very telling. Rob, how did those response changes that you guys implemented affect the membership?
Well, significantly so. As you can imagine, a call volume like that has profound effects on anyone working in a hall like that. Call volume alone is certainly a significant risk factor for mental health and fatigue. And then you compound that with an opioid crisis where you're seeing, sometimes, to be frank, you're seeing the same patient 3 times on one shift, or repeatedly through your tour of duty. And you get this sense, and Brian touched on it, called compassionate fatigue. You see it with our members. They get the sense that the work they're doing isn't manifesting in a positive outcome. So by adding those extra resources, one, it reduces the call volume any individual member would see. And that's significant and certainly helpful when it comes to their mental health. And I think that's important, and we should definitely not overlook that.
Thanks, Rob. Brian, what about you? What did you see with the membership after the program was implemented?
Real quick about data also, when we got that grant, we started to track. We have iPads in the car with us, so when we go to homes, we'll put it right in the computer at real time, and then we'll be able to see where most of the overdoses are happening in the neighborhood, what neighborhood we need to get more people out to get Narcan out there. So that was part of the grant, being able to get a dashboard made up for the BFD Knock and Talk program. Like Rob said, we have an area in Boston. It's, I don't want to say not as bad as downtown Vancouver, but it's getting there. And there's a firehouse that works right around the corner, and they're going on to like 20, 25 calls a day to that area. And they get that compassion fatigue. But then when they learn about programs like we're offering, surprisingly, we've gone to houses where, whether it's a firefighter's kid, son, daughter, brother, sister, aunt, and then that gets back to the firefighter in the field. And knowing that Boston Fire cares about my family, it goes a long way. And in Boston, I think we've lost 8 members, family members, in the last 2 years from opiate overdoses. So we're just trying to educate members and let them know that this resource is out there. If they go to a home and they're getting aggravated because they've been to the same home 3 times, call us and we'll send a few recovery coaches over there. We'll get them hopefully the help they need.
Great, thank you very much. So we've talked about a lot about all the great things that the change in response and the program have implemented. But if there was one thing you could warn the membership about, if another local was going to attempt a program or response change, what would that be? What would that number one pitfall be, Brian?
Well, in my city, it's traffic in Boston. We might have 8 addresses to go to, and it could take us 7 to 8 hours just to get through traffic. Fortunately, right now, there's not much traffic, but traffic and just making sure that people who are out there doing this type of work, the recovery coaches, are getting help themselves because they see a lot and they're dealing with a lot. We've been to homes where we thought we had pretty good data, and then we get there and the mother answers the door and she lets us know that her daughter passed away last night. So just making sure the people dealing with this are getting the help they need. And we're so fortunate in Massachusetts with our leadership from union leadership, Jay Colbert, third district vice president, Richie McKinnon, the professional firefighters of Mass, and Bobby Petito, local 718. Like, they make sure we get all the resources we need. Which is great. We can go right to them and they'll make sure we have all the resources we need.
Great, thanks. Rob, what about you? What would be the one thing that you would warn other locals about as they go to implement a change such as yours?
Yeah, I think I'll say sort of 3 things that are all tied together. When you need the public support is not the time to start a public campaign. So number 1, get your branding out ahead of time before you actually even need the public to support one of your issues. Make sure you're front and center in the public. Also, it's not the time to get politically engaged when you actually need your decision makers to make decisions to support you. So get ahead of that. Start building those relationships now. At the very least, make sure you're part of that conversation. And then in addition, when it comes to data, own your data. So, you don't want to find yourself in a crisis and be scrambling to be able to frame or tell your story when it comes to data and scrambling to find that information. You need to be ahead of that, own it, and know it. So do what it takes to get yourself embedded in your data. Try to make partnerships with the city. If not, use your FOIs. Try your best to get as much data as you can so you're able to articulate those arguments in the best way and from a position of power when you're talking to decision makers in the public. So that would be my advice. Start now before the crisis happens.
Brian, do you have anything to add?
Just the data has been great for us over the last few years. In 2018, that's when we really started collecting the data and just showing that the program is working, showing that the deaths are going down, showing that people are getting into treatment, and just focusing on different neighborhoods. There was one thing I didn't mention. We started FAITH, it's called Fighting Addiction in the Hub. And we started having little things in firehouses where people could come and learn about resources with opiate addiction. We could train them with Narcan and then just have a few treatment places there offering services. And that went really well. We did that 2 years ago, and we're going to start doing that up again. And more recently, with COVID going on, they were not able, there's a place downtown, they call it Methadone Mile, but there's a lot of treatment places down there. And they have this place where people can go if they want to go into inpatient treatment. And with the COVID stuff going on, they were not able to transport these people. So we trained these 10 recovery coaches last year, and they wanted to help out at some point. So we've been doing transports for these people into treatment. And that's, in my opinion, the ultimate goal. We can keep knocking, but we need to get these people help. They need to have some place to go, some place to live, try to get them in the workforce. It's a much bigger problem than just the drug. It's a workforce problem. So with these recovery coaches and transporting and building relationships right from the beginning has been great.
Great, thank you very much. So certainly the Boston Intervention Program and Vancouver's Change and Response have had some real positive outcomes for the citizens and the membership alike, and enabled your departments to still meet emergency demand, or at least give you a lot more flexibility. As we wrap up, what are some long-term benefits for the locals in relation to improved operational efficiencies essentially, how could you take these models that you've built and apply them to other potential prevention programs or just response to demand in general? Rob, if you want, you could go first.
I guess I'd say this, adding more staffing so that we can meet North American standards is absolutely critical, and we're not there yet. So I spoke earlier about a 5-year growth plan. That'll certainly help, with our member safety and the public safety, because that's why we're in this business. Going forward, I think it's critical that we make sure that we still own our data and we look at new ways to frame our data that's important. And I'll give you an example of that for us. Because we're a really dense city with many high rises, there's a distinct difference between getting to the front door of an address to getting on scene with that patient. So we're now making sure that we have the right tools in place and education for our own members. So, because let's be frank, it's not always just the department that's responsible for poor data if that's the situation you find yourself in. It's our own members sometimes need to be educated and understand why the data is important and why they're doing the things they're doing to help you advocate. And on scene with patients, an example for us with that, we've gone out and supported the department and educated our own members to make sure we can capture that data so that if we arrive at a scene at the front door of a high-rise building, sure, we may get there in time according to NFPA standards, but the time we get to the patient could be double or triple that time. And so how do we capture that? How do we frame that narrative now moving forward so that we can continue to advocate for growth, so that we can meet the demands of our citizens and our staffing demands for our own safety. So those are all things we're looking at moving forward, educating our members on the importance of data and looking at new ways or new data we need to collect to be able to be the best and strongest advocates we can moving forward.
Great, thanks. Brian, what about you?
Similar to Rob, data, that might be one of the biggest pitfalls of the program. We have a lot of large residential buildings where there's 10 to 20 families living in them. So when the firefighters go to these houses, just having them code it right and trying to get us the apartment number, the right information. So when we do these follow-ups, we'll be able to go right to the apartment, because we also got to be careful of confidentiality and people knowing, other neighbors knowing that we're going to their house for an overdose that happened there. So having members keep good track of apartment numbers, names, and that way we'll be able to get to these, because a lot of times we'll go to the houses and we'll have no apartment and we're not able to engage with these people. And just expanding it, that's the plan. It's just it's working, expanding it and trying new things. The area methadone mile, which I like to call recovery mile, that firehouse, these members, like, they want to be at that firehouse. It's very prestigious, has a lot of history. A lot of their fathers worked in that firehouse. But you're seeing it change a little. Like, guys who thought they were going to finish their career are starting to transfer. So we need to help these members out and maybe get more resources down there. But the data is the biggest thing. And guys in the firehouse keeping track of the data for us, so when we go to these homes, we have good addresses.
All right, fantastic. Guys, thank you so much for participating in this informational session and sharing your experiences and the passion with all of us. I would like to just take a moment to point out the importance of the fire service and prevention in our communities, but also highlight the difference that our membership makes in the communities that we serve. Again, thank you for joining us. Stay informed and stay safe.
Thank you.
Thank you.